Welcome to our lesson on the integumentary system. In this video, I'm using an AI-generated voice to guide you through the material. All content has been carefully reviewed and edited for accuracy, and the goal is to make learning medical terminology and anatomy clear, consistent, and easy to follow. As we move through the lesson, we'll focus on the structure, function, and terminology related to the skin and its accessory structures. The word roots, derm, and dermate both mean skin. You'll see these roots frequently in integumentary terminology, especially when describing diseases or conditions affecting the skin. Dermatitis breaks down into word root dermate, meaning skin, and the suffix itis, meaning inflammation. Dermatitis literally means inflammation of the skin. The root kerat refers to hard or horny tissue and relates to keratin, the protein that strengthens and waterproofs the epidermis. Keratosis is built from the root kerat and the suffix osis, meaning abnormal condition. This term refers to an abnormal condition involving keratinized tissue. The root melon refers to black or dark pigment and is associated with melanin, the pigment produced by melanocytes in the epidermis. Melanocyte breaks down into melon, meaning dark pigment, cyte, meaning cell, and the suffix e. A melanocyte is a cell that produces melanin. The root seb refers to sebum oil, while sebase refers specifically to oil glands, known as sebaceous glands. Sebaceous combines the root sebase, meaning oil gland, with the suffix us, meaning pertaining to. Sebaceous means pertaining to oil glands. The root hydra refers to sweat and is used in terminology involving sweat glands and perspiration. Hyperhidrosis breaks down into the prefix hyper, meaning excessive, the root hydra, meaning sweat, and the suffix osis, meaning condition. This term describes excessive sweating.
These prefixes are commonly used in integumentary terminology and help describe location and severity. The prefix epi, meaning upon or above, is used in the term epidermis, which refers to the outermost layer of the skin. The prefix sub, meaning under, appears in subcutaneous, describing tissue located beneath the skin. The prefix hypo, meaning below normal or deficient, is seen in the term hypodermic, referring to something applied or injected below the skin. The prefix hyper, meaning excessive or above normal, is used in hyperhidrosis, a condition involving excessive sweating. As you learn these prefixes, pay attention to how they help you understand location and conditions related to the skin.
These suffixes appear frequently in skin-related diagnoses and are critical for interpreting medical terms accurately. Now let's look at some common suffixes used in integumentary system terminology: itis, osis, oma, and cyte. The suffix itis, meaning inflammation, appears in the term dermatitis, which refers to inflammation of the skin. The suffix osis, meaning abnormal condition, is used in keratosis, describing an abnormal condition involving keratinized tissue. The suffix oma, meaning tumor or mass, is found in melanoma, a tumor arising from pigment-producing cells. The suffix cyte, meaning cell, appears in melanocyte, which is a cell responsible for producing the pigment melanin in the skin. As you learn suffixes, notice how they often describe conditions, diseases, or cell types related to the integumentary system. When you understand word parts, you don't have to memorize every medical term. You can break down unfamiliar words, determine their meaning, and communicate more accurately in healthcare settings. In the next lesson, we'll apply these word parts to integumentary diseases, disorders, and procedures, strengthening your ability to read and understand clinical terminology.